This is a contrast and CT scan of a 23 years old male patient. The patient presented with multiple painless intraabdominal masses. Now please observe that there is a large left paraaortic mass. The mass has surrounded almost 50% diameter of aorta. Now this is the left renal vein. There is no involvement of left renal vein. This is left renal artery here. There is no involvement of left renal vein or left renal artery. There is mild hydronephrosis on left side. As I scroll it down, this is dilated left ureter. There is a large mass in the pelvis. It shows non-homogeneous enhancement. Its interfaces with the adjacent small and large gut segments are indistinct. There is no involvement of urinary bladder. It extends downwards into pelvis posterior to the urinary bladder. Now this is a moderately thick walled cystic lesion here, this one. When traced anteriorly, a tubular shadow is seen extending into right inguinal canal and is involving right spermatic cord. Now when I trace it down, please observe that this is the right inguinal canal and the right spermatic cord, but there is no spermatic cord on left side. No history of undescended testis on left side was provided. But since there is no spermatic cord on left side, when inquired, it was disclosed by the patient that the patient has got only one testis. So it is a case of seminoma of left testis. Now this is the enlarged tumorous left testis seminomatous, and the tumor has infiltrated outside the confines of left testis into the lower abdomen. The findings are very typical of a tumor involving undescended intraabdominal left testis, and the left paraaortic mass in fact is the lymphoid mass. So one important thing is that in any CT scan where such findings are present, now the likely differentials in such cases, if there was no history of undescended left testis, the possibilities could have been that this is a lymphoma, and if there is a history of undescended left testis, then obviously nothing else but the seminoma of undescended or intraabdominal left testis and its metastatic deposit in left paraaortic region. So he must look into each and every corner of the images provided to us to gather any information related or unrelated to the pathology. Now I will show you his post chemo CT scan. This is the post chemo CT scan which was done about 4 months later. Now this is the lymphoid mass. Please observe marked regression in the size of left paraaortic lymphoid mass, which was metastatic. Now this is the residual mass lesion in the pelvis. Now this is the tumorous left testis, seminomatous. The size of the lesion in lower abdomen or upper pelvis is markedly reduced. Now please observe that this is the oblong, moderately thick walled cystic lesion. This one, its size appears to have enlarged. Now this is traceable downwards and is merging with the right seminal vesicle. This one, when traced anteriorly, it extends into the right inguinal canal involving right spermatic cord. there is no spermatic cord on left side. Now in this particular scan, this is the right testis, this one. No left testis is present in the scrotal sac. This oblong cystic shadow here, this may represent the right seminal vesicle. Its lower end is obstructed and it is distended. Initially in the previous scan, it was compressed and appeared smaller by the large tumorous mass in the pelvis. Now since the size of growth has reduced, so it appears to have expanded because of non-compression by the pelvic tumorous left testis. So it is my humble advice that in any investigation which is provided to us, we must first go into the details of the history. If not provided, then we must look very carefully into each and every corner of the investigation to collect the information.